Welcome back, everyone. I hope you enjoyed your break. I'm happy to welcome you to session 2A Stronger Together. As we know, the connection in heart failure between the body and mind is vitally important. Our three speakers today, Dr. Rob Nolan, and two individuals with lived experience, Kim McLeod and Ryan Davies, will discuss that vital connection between mental health and cardiac health throughout the care continuum. Enjoy, everyone.
Thanks, Mark. It's really a pleasure and an honor to share this session with my co-presenters, Ryan Davey and Kim McLeod. In this session, we're going to talk about key life events or milestones in the journey with chronic heart failure and how these milestones can be experienced as a really important challenge to one's emotional well-being, but also as a really important opportunity to connect with a sense of living well and a sense of having a good quality of life. And to do this, it's really essential that we ground this discussion in the lived experience that you can identify with. And it's my pleasure to hand over our presentation now to Kim McLeod.
Oh, thank you, Robert. I appreciate that. So I'm blessed to be here today. I'm so happy that I get to participate. I'm just grateful to be alive and be able to share with everybody my lived experience, my story. So mine is one of hundreds of thousands. I'll begin my story back as a caregiver for my son over many, many years through pediatric healthcare and supporting him with chronic a declining medical condition. And it was really in the final 5 years of his life where that caregiving became very home-based and was like running an ICU at home. My son did pass, and as I started to look at my own health, I guess it was January after he had passed, they found that I had an enlarged heart. And my family doctor was like, oh yeah, so you had one of those back in 2012. This is 2016. I'm like, how do I not remember that I had one in 2012? Well, I didn't remember because I was a chronic caregiver and my time was occupied. So that's fine, move forward. I get an echo scheduled. And next thing I know, I have a virus. And with that virus, I just was so breathless after. I was like, I'm sure I have pneumonia. Like, what's going on? And she did an x-ray. She's like, no, it's not. But the echo happened to land at that same time. And when we got the results for the echo, I remember that phone call from her. She's like, well, the reason you're breathless is not pneumonia. It is that your heart, your left side of your heart is only functioning at 24% ejection fraction. And this is why you're experiencing so much breathlessness. I just remember laughing. The twist of fate for me to have been so chronically in healthcare, to thinking that I'm stepping out. I have the opportunity to care for myself now, and being thrown back into whatever this is. But I remember also in that conversation with the doctor, trying to understand where my life is going next. What am I doing? How do I live with this? That one of the questions I also had was about, choosing not to have care. And he didn't answer the question. He didn't answer the question until it was the third significant visit and I was stabilized on medication. And then he had the confidence to answer that question. I mean, we came from different places, right? I came from a place that I was comfortable with looking at death and having planned my son's death with him and moving forward with that. But the doctor wasn't. And that was a bit of a challenge for me because his focus, not just about death, but his focus was just strictly on, we're going to make this better. Where my focus was, well, how can I do X, Y, and Z in my life? And there was never sort of a conversation between those 2 points. His was just about, well, we're going to try this medication. And mine was, well, how do I walk upstairs and take a shower? And so those functional pieces of my activities of daily living were never really addressed. So I asked to see somebody else, and it was after that new referral. There wasn't any new information, but I was able to identify at that time that I was also carrying forward a lot of stress, anxiety, reactions to isolation, and reactions to healthcare. So it was like PTSD that I didn't want to be in healthcare, and I'm having reactions about healthcare before anything happens, assuming all the worst things are going to happen, and all the worst things from a doctor that they could say might happen. And I didn't need to be in that space. And it was enough that I told this new cardiologist, which kickstarted, some assessment with the psychologists of the rehab program, which is great. But then it was bumping me to, community and some community-based activities that were free. If I had funds, if I had funding, if I had benefits, then I could access more, but it's limited in the community part. And so that takes me to 4 years trying to figure out on my own how to function in my activities of daily living, and how to manage the stressors that come with that. How am I going to be who I used to be, or how am I going to become this new person? I mean, that was a very long and lonely period of time. And I think one of the successes of meeting that also, because I always look for successes, is I finally decided that nobody's going to make me walk. Nobody's going to come and walk for me. So if I'm going to walk, I may as well just start doing it. And last summer, I just started walking, and small periods of time, would walk a certain distance and walk back so that I could be successful. I didn't want to be stuck somewhere. And I increased that. And my next goal was to get to the river. And the next goal was to get to the beach. And the next goal was to get a little bit further, 100 meters more, 100 meters more. And by the end of the summer, I was able to walk to our local beach and back, which was 1 hour and 40 minutes. It was too much, but I did it. And but it took me 4 years and a lot of mental gymnastics to get there. The Heart Life Foundation, I've been participating in that group for well over a year, maybe 2. I'm not sure, but that group, right? The peer-to-peer support has been the only place, the only connection I've had that's normalized what it is I'm experiencing. That's normalized that it's okay to function in this new way. And for that, I've got great gratitude that I'm no longer alone, that I can choose to go and be supported with people who get it. And yeah, so I'm glad to be of service here today and share my story, and glad that Heart Life has been there for us. Ryan, if you'll share your story, that would be great.
Thanks, Kim. Yeah, my story is somewhat similar to Kim's in the sense that I caught a virus that attacked my heart. It was originally misdiagnosed as anxiety. I had gone to my doctor as I got sicker and sicker, basically. He listened to my chest, he checked my blood pressure. At the time, everything was fine. So he put it down to anxiety, given the fact that I was in a stressful job, and there was a lot riding on me at work, and I was working a lot of hours. So I treated it like it was an anxiety attack. Every day was getting tougher and tougher. I could walk less and less. It was getting harder and harder to breathe. But I kept working through it, thinking, this is just anxiety. This is all in your head. Just get through it. Until it just hit me that this can't be anxiety. This has to be something else. And I remember calling my doctor's office one day, about 3 months later, and saying, I have to see him today. There's something seriously wrong. And I went into his office, and he listened to my chest again and checked my blood pressure, and he sent me straight to the emergency room. When I walked in from the parking lot, I didn't even get to the triage desk. The nurses met me halfway. They put me on a stretcher, shirt was off, sensors on. They said I was gray. It took a while to figure out all the pieces, but basically the virus had doubled the size of my left ventricle and it had twisted. That was cutting down blood flow. So my ejection fraction was down to only 9%. That created a problem because my heart was too weak to pump away the fluid from my chest. So I had 25 pounds of fluid built up around my heart and lungs. I had pneumonia in both lungs. And when I would lay down to try and sleep at night, that weight of the fluid on my chest would collapse my lungs. So I hadn't been able to sleep. Again, kind of thinking just, it's an anxiety thing and I'm busy at work. So I ended up pulling all-nighters for a couple of weeks and living off of, 10 to 12 cups of coffee during the day to stay awake. And so for 2 weeks, I got very, very little sleep. And what I didn't realize was that level of sleep deprivation created a very large blood clot inside my heart. They were very concerned. They did an ultrasound and it showed that this was a huge blood clot hanging on by just a thread. And they were treating it with blood thinners to try and decrease the size of it. But the main concern was if that disintegrated where it was attached, if it went into one of my limbs, they told me they would have to amputate. And if it went up to my brain, I would have a stroke. And speaking of my brain, it was not getting enough oxygenated blood. So it was starting to shut down functions. It had stopped sending automatic signals to my lungs to operate. So I was having to consciously take breaths all the time. And that had been for about a week before I got to the hospital. And if I got distracted talking to someone, or if I dozed off and fell asleep, I would stop breathing until I would wake up gasping for air and have to keep breathing again. So it was a very serious situation. I live alone. And when I was sent home, my heart was still so severe. I think my ejection fraction was only at 11 or maybe 13% at that point, still very severe. And living alone, I was put on 24/7 bed rest. My doctor said I could get up to use the washroom, I could get up to eat or drink something, and I could get up to be taken to a doctor's appointment. The rest of the time, he wanted me sleeping or on the couch just resting. And I was on those orders for the next 18 months. So a year and a half living by myself on 24/7 bed rest. And they gave me a PSW for 2 hours every Thursday for the first 6 weeks, and then the funding ran out and that was taken away. So it was incredibly hard. Living alone, I still had to do all the chores. I wasn't allowed to open a window because the amount of resistance that a window gives was more than the 5 pounds I was allowed to lift. And my cardiologist said, you'll trigger a heart attack if you try and open a window. So no fresh air, just stuck inside, sleeping my life away or resting on the couch. It was a hard existence for me for a year and a half. And I got incredibly depressed. I got to the point where, every task was a struggle. Everything that I needed to do, whether it was as simple as going to the bathroom, just picking up a glass of water to take a sip, everything seemed impossible. Everything was hard. So I got incredibly depressed. I felt hopeless. I got suicidal. And it got to the point where I would just sit on my couch and rock back and forth for hours, just staring off in the distance. I was mentally broken. And my family doctor finally called my cardiologist and said, I think his heart is now secondary. If we don't get this guy up and moving around in fresh air and deal with his mental health, he's going to kill himself rather than have his heart give out. So the cardiologist knew how serious my heart condition still was at that point, even after a year and a half of bed rest. And he understood, how difficult that lifestyle was and the effect it was having on my mental health. So he allowed me to get up and use a walker to walk outside for 20 seconds per day. After a year and a half of recovery, that was all I was allowed to do was 20 seconds per day. But that was a huge change for me. I loved those 20 seconds. That was the one thing I could look forward to in my day. That was a chance to get outside and get a breath of fresh air. And if you've been inside for a year and a half without being able to open a window, Just getting outside for a breath of fresh air. I didn't care if it was pouring rain, if it was a snowstorm. I did not care what the weather was like, if it was freezing cold or boiling hot in the summer. I was going outside. So that started to turn things around, and that helped me to really think about how I wanted to exist in my recovery. So instead of thinking of every task as being impossible, I had to start celebrating all the small things that I could do, the things that I was actually achieving. If I could climb 5 steps before having to sit and rest, I could either sit there and look up at the rest of the staircase, knowing that I've given it my all just to get these 5 steps. I've got nothing left, and think, how am I ever going to get to the top of the staircase? Or I can sit there and be really proud of myself for climbing 5 steps, because when I got home from the hospital, I could only do 2 steps. So look how far I've improved, and this is awesome. I'm actually recovering. And that switch in the way of thinking changes how you look at day-to-day life and every task. You can either be defeated by what you've been through and feel like everything is hopeless and everything is impossible, or you can look at every little tiny thing as a huge success, that you just won the gold medal because you were able to lift up a glass of water and take a sip, and that makes your days enjoyable. All of a sudden, you're proud of yourself, you're recovering, there's hope, there's a light at the end of the tunnel. So that's how I really had to switch my thinking around. But the mental health side of it, I really think needs to be looked at as a key part of any kind of long recovery.
Thanks. Well, on this journey from having a diagnosis to being in a really grave situation where you're talking about, imminent mortality and the need to try, whatever intervention they could have, to where you are today, I know that there's been an amazing transformation that's taken place in your experience. So I'll go through some slides and I'll pull out some key strategies from cognitive behavioral therapy that are guidelines to help people improve their quality of life and emotional well-being. But Kim and Ryan, I'll really ask you to offer any comments to connect the strategies that I'll introduce to lived experience, all right? And then we'll also invite our participants from the floor afterwards as well to do the same. Is that good?
Yeah, sounds great.
Cool. Great. Okay. I just really want to briefly touch on use of multimedia and dramatic vignettes in the work that we're doing. And the work is a previous trial for patients with heart failure where we tried to improve quality of life called CHF Support, and a current trial called VChat where we're currently recruiting participants. And I'll touch on self-help skills and strategies from CBT, or cognitive behavioral therapy, that are really commonly used to prevent or manage periods of increased psychological distress. And finally, I do want to just cover some recommended guidelines to improve quality of life throughout the journey with chronic heart failure. So we've used dramatic vignettes because I don't know of a more effective way other than to have real people telling their stories, much like Kim, you and Ryan have done, where people can really engage more holistically with the events that are being discussed, right? And what we are trying to do in this work is to reflect and validate the experiences of individuals as they do their best to manage the challenges of their situation. And certainly we're hoping that there's positive role modeling from, that's demonstrated through the dramatic vignettes and also through the feedback of participants in our trials to help people move forward in their journey with heart failure. What really strikes me though is, what's a natural response to milestones or key life events in the journey with chronic heart failure? How can you assess your emotional response to these milestones? And what are some key cognitive behavioral skills for managing your response to these milestones in your journey with chronic heart failure? So I just wanted to put on this slide to highlight that it's really natural, of course, to have the ups and downs emotionally as one experiences key events, from diagnosis to the challenges of learning a whole set of treatments, to looking at the natural course of your symptoms. Sometimes they're terrible or bad or worse or manageable. It's the variability that can be very difficult, to also the challenges of moving forward with other life priorities. So we noticed that symptoms of depression are common in about 1 in 5 to 1 in 3 individuals with chronic heart failure. The symptoms of anxiety that are clinically significant are reported by about 30% of individuals with chronic heart failure, and that these symptoms are more common in women versus men. And that might be because the diagnosis is typically made at an older age for women. So that might be accompanied by multiple comorbidities, less cardiovascular fitness, or less social support, and often increased responsibilities for caring for others still in the family setting. So,
Robert,
yes.
there's just a couple of things that I wanted to touch on from those first few slides, if I can input here. Is, the conversations that I had with my cardiologist in the first days had nothing to do with how I was feeling, how I was coping with the situation. How did I have any family support? It was strictly about medication, and it was strictly about how they were going to address the physical part of my well-being, and that really left a sense of isolation that really contributed to some of the suffering with these new symptoms and this new management of becoming this new person. And it wasn't until I found some peer groups, and Heart Life is one of them, having a peer-to-peer meeting once a week, where I start to hear not the vignettes, but the real life stories from other people living with heart failure that made a difference and normalized so much of what I was experiencing. And I just wanted to pause here and be sure to highlight that opportunity to find somebody to speak with from the onset, because it has not come from the doctors. It's not part of our rehab program. It's not part of the methodology to date. Perhaps it'll change, but.
It's so true, isn't it? There's a lot of focus on managing physical symptoms or pain, but the difference between pain and suffering is that with suffering, it's experiencing pain when you feel that people aren't clued into it. You feel isolated or lonely, as you guys are saying, and that's, I couldn't agree more. That's where we need to transform the system, and that's why personally, that's why I'm so invested in the work that we're trying to do in this new trial called VChat. We're trying to build a virtual social community, and I'm working with Jillian Code, who's a co-investigator on this, and I think Heart Life's work is fantastic. All we want to do with VChat is to measure and to demonstrate and prove, the therapeutic value of exactly what you guys are talking about. I don't want to linger on this slide, but I do want to say to our participants that if you want to gauge your own symptoms of stress or anxiety, there's a scale called the PHQ4. You can download it from the internet, or we're happy to give this as a handout at the end. And it's widely available, but it's really well-based in research. And the bottom line to this is that if you have a score of 6 or higher, it's an indication that you should consider talking to somebody about your symptoms of anxiety or depression. And you can see the values for the scores, items are there. I guess in the interest of time, I'm going to move forward, but I don't want to downplay the importance of it. Okay, so I'd like to then mention, let's say you're scoring high on this scale, you notice that you need some assistance. Here's some self-help strategies from CBT or cognitive behavioral therapy. The first one is to pay attention to the kind of self-talk that naturally kicks in. When any of us are under stress, it's natural for us to feel a bit overwhelmed, and we'll say things to ourselves like, well, I can't believe this is not ending. It's just going on and on. I don't know if I can handle this. It just gets worse and worse. And you can imagine how that impacts us emotionally over time, the longer that self-talk plays. So the first guideline from cognitive behavioral therapy is to interrupt that negative self-talk. And you can use a phrase like, don't go there, let it go, stay focused. And then use that pause to shift your activity and attention to something that's pleasant and meaningful. So an activity that you want or need to do. And that's a great way to just try to prevent this from escalating, because the longer it plays, the worse one will feel. And another way to do this is to shift your attention to activities that you can use routinely in your week or day. And so you can use these activities to clear a space to regulate your mood or emotions. And these are things like meditation or relaxation, or music, reading, exercise, or connecting with someone.
Yeah, so I'm just thinking past and through some of the issues I had to deal with coming into my heart failure. And I remember having to apply some of these strategies, don't go there, particularly thinking about it, because in the first year, my grieving was so, I don't know if my grieving was so intense, but when I would cry, a very grievous cry, my heart would ache. I would have palpitations. And so I really had to work at ways of missing him, grieving, but also being conscious that I need to delay a little bit of this. It's not going to be gone, but I need to sort of give my heart some space to recover. And so I had to talk to myself, don't go there, not right now. Okay, we'll do that tomorrow, or I'll come back to that, and really provide myself with some space and time to do that, and also I think grace and self-compassion to be able to be successful in the simplest things of taking joy in watching a comedy, taking a break, reading. Exercise was not an option initially because of the breathlessness, but there were other simple pleasures, and that had to be enough and okay. So I just wanted to share that piece. Thank you.
That's so vital. Yeah.
I wanted to add as well, that was really hard at the beginning. I wasn't progressing the way I thought I would, or the way they thought I would. And the depression got really severe. So a lot of times I would do these techniques. I would tell myself, well, you're really depressed. You need to do something fun. You need to do something for yourself. But the problem when you're that depressed is those activities don't seem in the moment like they're going to help. And one of the things that I learned was to kind of have a list made up when you're not quite that depressed of activities, and just force yourself, even if you don't think it's going to help, just force yourself to do something that you used to find enjoyable. And what you would find was, even if it didn't really change your whole day around, it helped. And instead of just wallowing in your own depression, now you're doing something better and you're on the right track, So that was a big technique that I learned. These having these activities, and having a list of things that you enjoy doing that are possible to do with your heart condition, and just forcing yourself to do it even when you don't think it's going to help.
Sure.
Yeah, it's so important, isn't it, to think of activities that you can do by yourself or with somebody to vary it up. But activities where you do have some control over being able to do that activity. And as you said, Kim, exercise was out of the picture initially, but other things were possible, right? And yeah. Okay, so where cognitive behavioral therapy would go from here is to then talk about, well, how can we extend our work in terms of shaping how we think and feel in the situation so that it carries over positively to our activities. So this is just an example from one of the videos in our work where negative self-talk is there in the character. And really the theme here is, how do we accept our experience as our starting point and transform the negative self-talk with a more balanced view and a response that's self-affirming. So how we do that are by two strategies. And actually, Ryan and Kim, both of you have mentioned some of these already. So one is countering. And if you think of negative self-talk, self-talk, you can recognize it, that's negative because the glass is always half empty, right? And we always feel like we're not doing a great job. Things are incomplete, not getting done sufficiently. And the longer that plays, the more we can accept that as being a fair view of our reality, because we just get used to those phrases. But really, what cognitive behavioral therapy would say is, if you're feeling, it's going to affect you emotionally. So as you notice those emotions, think of your self-talk and ask yourself, what makes that negative self-talk the only valid way to see my situation? Or you can also counter it with, even if I'm distressed about my situation, what's the best way that I can respond right here and right now? Or instead of letting this distress just overshadow my morning or afternoon or day or week, how would I rather respond? And suddenly that energy, instead of being burnt up with aimlessly kind of with the negative self-talk that just goes on and on, starts to get focused on a practical and helpful activity that will change how you go through the day. So countering can be used with priming positive self-affirming self-talk as you start to do those activities that both of you actually mentioned. And priming is using phrases like, that highlight your integrity. And it's just acknowledging things such as the effort that you're putting into trying to get well. So a phrase like, hey, I'm giving this my best effort. I'm being really sincere here. I'm doing my best, right? And that surely is something that you can say, at least at the end of the day, I can respect who I am, what I'm all about, and what I'm trying to do here. And confidence. We can also use priming to acknowledge and reinforce our sense of confidence with things like, I'm trying to do the best that I can do. I'm not going to give up on that. And I believe in myself. And I believe what my life's all about. Or self-esteem. I respect my effort. And this is how I can be the best person that I can be. It's just by moment, trying to respond in the best way possible, wherever that leads me. But at least I know that my journey suddenly is I'm being as fully myself as I can be. I don't know how that sounds to you guys.
We're both about to jump in.
Yeah.
That whole moment by moment piece was big in my mental scape, I guess. I had lived that way with my son for many years because he was expected to die and lived many years beyond. But that moment to moment, that's part of the grace and self-compassion that I was talking about, is being in this moment right now. I am doing my best right now, and this is enough for right now. And there'll be another opportunity in the next moment or perhaps tomorrow, but all I can control is how I am in this state right now. And it has served me time and again to keep myself here, and has helped with any anxiety, and to just come back to this moment and do that positive self-talk.
You can trust in that, can't you? You can trust in the process of just where you are right here, right now.
That's right. Yeah. Did you want to say something, right?
Yeah, for me, it's I'm giving this my best effort. That was huge for me. Having such a long recovery and it being so difficult, I think I really took that as a personal failure, that this was my fault. They said I should be recovered in 3 to 6 months. And I'll be honest, when they said 3 to 6 months, my brain said 3 months, great, I'll be back at work, So having it go on and on and on, I just felt like I'm failing. I'm no good. This is, I'm not trying hard enough. There's something wrong with me. And it wasn't something wrong with me. I was facing an incredibly severe condition. I've had my cardiologist has gone around the world presenting my case, and he tells me no one has ever survived that much damage to their heart, and they don't know what to expect with my recovery because they've never seen it before. So this isn't my fault. I'm not a loser because I'm not back at work. I'm facing an incredibly difficult battle. And it was that switch of my mind around to say, no matter how hard this is, no matter how difficult it is for me to do, and no matter how lousy I am at doing what I thought I wanted to do, it's my best. I'm giving it my absolute best. I am giving it every bit of energy that I have. And if my heart says, nope, we're done for now, then that's my heart telling me it's time to rest. And that doesn't make me a loser. I still gave it my best. I can still be proud of myself when I look at myself in the mirror. And understanding that was a huge shift in my mental attitude throughout recovery.
Yeah.
I just want, can I just add in there? Because I totally get that. There's also space to have grief and loss for the life that I used to have. You know, like, yes, I totally get those resting in these moments, right? Just as you've just described so beautifully, Ryan. And at the same time, you can also have the existence of grief, of not being the person that I was before, the the activity that, you know, being able to rush around and do stuff and rush into the grocery store. Now I'm just huffing and puffing as I, you know, try to get into the grocery store. But those are little mini griefs that occur, as well as being affirmative and self-talking, and I'm here and I'm present. Those two can exist at the same time, and they have to, as far as processing for myself to move forward to become this new person who lives with heart failure.
Yeah. What I hear you guys saying is, on a journey, it's not just looking down the road about where you want to end up, it's how you get there, and it's the process of becoming, I guess, right, the person that you want to be en route. And that's what it's all about, if I hear you guys correctly.
Yeah, I would agree. Yes.
Yeah, absolutely. And I think it's understanding that, you know, this illness doesn't define you. You get to choose how you're going to experience this recovery and who you want to be throughout it. You know, so it's understanding that you have the opportunity to kind of redefine what your day-to-day life is going to look like.
Mm-hmm. Okay, so I'll go to the next slide, and it just focuses on the journey. So how do we put all this into action? And what we try to suggest in the VChat program, as well as in cognitive behavioral therapy, then, is to plan activities that can transform one's life, the way that you guys are talking about, actually, you know, because they make us experience each moment very differently. And so what I would encourage people to do is to think of activities that connect you with a sense of living well. And you can plan whatever ones work for you. There's no magic activity that is everything for all people all of the time, right? So the basic types of activities to think about, where, you know, that are connected to a sense of living well, are things like feeling connected to loved ones or close friends. Could be a phone call, you know, just to be close to them, or an activity where you can enjoy pleasurable experiences, good food, art, music, relaxation, sexual intimacy, or an activity that helps you to feel more attractive, or that you're optimizing your health. It might be exercise or some special diet item, or an item of clothes or cosmetics. It just helps you to feel more attractive or better about yourself. Or an activity where you feel like you're fulfilling the roles and responsibilities that are important to you for a loved one, family member, spouse, or even at work. Or an activity where you feel connected to a greater purpose, whether that's a social cause, a charitable activity, or feeling close to nature, or in one's religion or philosophy. You know, that's important too, to help us feel that we're not alone. And then finally, an activity where we feel a sense of excellence in doing something that's special to us. It could be a hobby, personal project, something at work, but typically something where we feel we're growing with a skill or knowledge. So in sum, unless Kim, Ryan, do you want to comment on that part?
I did want to comment, just in the fact that, again, just reinforcing, you know, all these activities. There's the old mind that thinks of the activities, and then you have to assess it so that it's functional for you now. So yeah. It's going to look different. How I would experience going to art or music would be very different than how I'd have to pace it now for my energy consumption of a day. And
Right.
so I think that the term functional, I use that an awful lot. It has to be functional for you and the energy you have to consume in a day. And so just bearing that in mind. And then the other part that I was thinking as you were reading through it is that we can all participate virtually now, which is a great way to lift some of those expectations we previously had about I have to show up, I have to physically find my way to get somewhere, I have to physically navigate the entire museum, whereas now I can experience those things virtually. It might not be our ideal, I get it, but it just makes it accessible and functional for our current state. So I get excited about that because I can, right? I can, anybody can. So that's a great accessibility piece to remember.
Okay, so just to sum up, and first of all, thanks for making this theoretical guideline come alive, both of you. Really, this is the art that goes along with the science to connect it to lived experience, right? And that's the only way this thing makes any sense and has any value. But so what we've tried to cover, I guess, is talk about milestones in the journey with chronic heart failure that are both a challenge and an opportunity, and that there's potential to transform one's quality of life. And the tools that we've introduced and talked about briefly are thought stopping, countering, using meditation, relaxation, priming, self-affirming self-talk, and shaping our weekly schedule with activities that help us to feel connected to something meaningful to us. And I guess if anybody wants more information, feel free to contact me at this email address or telephone number, and I'm happy to forward the resources, and we will leave some of these as handouts anyways, right? Kim or Ryan, do you guys have any final comments?
Well, I'm pleased that we got to participate together and share delivering this in such a holistic way for everybody that's in the audience. And I think, thank you so much for that opportunity and for sharing the stage with me.
Yeah, as well, Rob. Thank you. It's these are the kind of techniques that really made such a huge difference in my day-to-day life throughout my recovery. And I know from going from such a dark place in my journey that there are times when these are brought up and you think, no, this is silly, it's not going to work. But I think you can tell from Kim and myself that when you incorporate these into your day-to-day life, they make such a huge difference. This is what gets you from that dark place where you're feeling hopeless to, yeah, I can do this. I've got this. I have to look at things differently, but this is doable. We can still enjoy life is if we shift our thinking and our expectations around, we still get to enjoy life even though we're recovering from something serious.
Hey, thanks both of you as well. It's been really, honestly, my honor to share this session with you because you're the expert on this journey, and it's just such a great confirmation to the value that's in some of these tools. And I guess it's in how they're used, right? So thank you for confirming how to use them effectively. So why don't we switch to the open floor then, invite questions and comments from the participants. Okay.